Hi class, welcome again to another session on rehabilitation engineering. So today, after discussing the gait analysis, let us carry on discussing the relaxation exercises. So what is relaxation? It is the state of the body where the muscles are comparatively free of tension. You know, you're totally at peace when you are relaxed. Now you can never say that muscle is free of tension because there's certain degree of tension called as muscle tone that is always maintained. So you can't define relaxation as a state where the muscle is completely relaxed. It is the state where it is relatively free of tension. You are at a state of rest, you are at the state of peace. That is called as relaxation. So relaxation exercises are prescribed for when there is a muscle spasm. So this muscle spasm can be due to acute or chronic pain, due to mental stress, due to systematic diseases, due to stressful lifestyle, due to if you're leading a very hectic lifestyle, then you might require relaxation exercises. If you're having some psychological disorder or if you're having hypertonicity and so on. So anywhere where the muscle requires some external assistance to, come back to its resting state, then relaxation exercises are prescribed. Now, the general principles of relaxation while performing relaxation exercise is that it should be in a position that supports the entire body, and then constructive clothing should be removed because constructive clothing means any corset or compression socks or any such garment should be removed because that can the tight garment can cause unrest within you. So when you are performing a relaxation exercise, you want to have a happy experience at the end of it. You don't want something tightly clinging to your body, right? That's why this constrictive clothing should be removed. Then the treatment room should be quiet. It should create an environment of peace. It should not have really loud hip hop music playing and all. And then the room should be dimly lit because that would bring that brings pleasantness to us. A brightly lit room actually increases the stress. And then the physiotherapist should be very well mannered, polite, and understanding. So they shouldn't be someone who's just throwing in orders and who's just inducing stress in a person. It should be like when you see a physiotherapist delivering relaxation exercise, you should be pleased about their presence. Their presence should be stressing you out. Again, the therapist should also be gentle and should patiently explain the treatment procedure. And then, certain irritants which can be avoided, such as, a full bladder. Full bladder would put you in stress. So, the patient should be asked to void their bladder before they come for therapy. So, these are certain general prerequisites that need to be followed before you start the therapy session. Now, relaxation training can be of two types. So, it is the method for general relaxation where the whole body is concentrated upon and the whole body is relaxed. And it is a method, and then the methods for specific relaxation where a certain part of the body is relaxed. Now, general relaxation includes meditative techniques for relaxation and then the physical techniques for relaxation. Whereas specific relaxation includes progressive relaxation training, then passive neuromuscular relaxation, the Alexander's technique, and then the Feldenkrais technique. So let us just have a look at each of these techniques in a little bit detail now. Starting off with meditative relaxation technique. So these can again be of four types. You have the mental technique where the technique focuses on the mind and the comfort level. So here the patient's thinking is the major component. So it you just have to make an attempt to keep the mind totally blank. I mean, it's like practicing meditation where all thought processes are focused at one point and then you just throw it off your mind. And then your mind is completely blank. You're not thinking anything except thinking about peace. So the mind is, if that state of meditation, that state of mastery is very, very essential. Now, it can be a daunting task for a therapist to ensure that the patient reaches that technique, but it also depends upon the patient's determination and the patient's mental strength. The second one is transcendental medication, where the practitioner has taught methods to subdue his thoughts and bringing in a state of peace. So the practitioner is just, knows the technique of subduing their thought and bringing the bringing the mind into a state of peace, and then they practice that on the patients. The third one is visual imagery, where the individual is encouraged to visualize something that is serene, and there's something that makes them calm down. For example, imagining the beautiful valleys of the Himalayas, where it is totally covered with snow, and all you can see is nature all around you. So that would probably bring peace to someone. I would like to sit next to a lake with a waterfall and enjoy the nature, or sit in a garden surrounded by trees and beautiful flowers that would bring me close to the nature. So that is something that would bring peace to me, thinking about trees and plants. So each and every individual would have something naturistic that would bring peace to them, and they are asked to imagine those things and enter a state of meditation. Now, last one is consciousness of breathing. So we know we often come across, breathing exercises that people do during yoga sessions. So you have the pranayama and various types of pranayama. So all these breathing technique actually encourages a patient to have that let go feeling. Just closing your eyes and only concentrating upon how you're inhaling and how the air is getting exhaled is deeply meditative. So this is also a technique that is practiced to relax a person. And if you're having if your whole body is tired, all you have to do is excuse the yelping dog. All you have to do is sit in a position with your eyes closed and just concentrate on your breathing, and that should actually do the trick for you. The physical technique include Jacobson's progressive relaxation, where the patients are encouraged to tense and relax a group of muscles sequentially, and then they are asked to concentrate upon the sensation. So while they are tensing a group of muscle, they understand the sensation of exactly what tension is. So if so, many a times we just don't realize that we have a certain body part that is tensed, and only when you acknowledge that yes, my fingers are tense, can I actually let go the tension and feel relaxed. So if my fingers are something that needs concentration upon, then I would constantly tense and relax my finger, and then understand the sensation of tension and relaxation. And only this understanding would allow me to get rid of the tension in my fingers. Then you have the Mitchell's simple psychological relaxation, where contraction of a group of muscles results in relaxation of the opposite group of muscles. So this works very well with agonist or antagonist muscle. So if agonist muscle contracts, then the antagonist muscle relaxes. So identifying which muscle is tense, you can stimulate the opposite muscle either through massage or electrical stimulation and relax this muscle. Now, last one is rhythmical passive movement, where the limb and head are passively moved by the therapist, and that brings in a state of relaxation to the person, because you just let go the tension, you just let the therapist do whatever treatment they want to do. So these are the physical techniques that would allow a person to relax. Now you have the local relaxation technique, which concentrates on pain relief in a specified area. So deep rhythmical massages and passive movement for localized pain relief are some examples. So you have the different types of local relaxation techniques as well, where there's progressive relaxation technique. So here the therapist focuses on a group of muscles, and these muscles are held tight or held tense for for a fraction of second, and during this the sensation of the muscle contraction is concentrated upon, and then the user is trained to relax this muscle by uttering a predetermined code word such as or I shouldn't say user, the patient is it relaxes these muscles when the therapist utters a predetermined code word like let go, because the therapist is touching that muscle that is tight. You would know exactly which muscle to relax. So that is something that is called as progressive relaxation training. And then you have passive neuromuscular training, where again the patient imagines that he or she is relaxed and repeats the words let go again and again till they are actually relaxed, till they actually feel at peace. Right? You have Alexander's technique, where the person is re-educated to maintain their posture. So often when you're relaxed, you have a very comfortable posture. However, when you have psychological problems because of which you are tensed, you forget to maintain the posture where you're relaxed, that you have during your relaxed position. So Alexander's technique actually re-educates the body to get back to that posture of relaxed state whenever there is tension. And then you have Feldenkrais method, where the Feldenkrais was an engineer who thought that brain is just like a computer. It can be programmed to imagine how each and every movement should be performed, and once it knows exactly how movements need to be performed, then it can also recognize the strain on muscles and joint, and if the sequence is faulty, and if the strain in the muscle and joint is recognized, then the brain can correct the sequence of movement to avoid that strain. So that is Feldenkrais method. I hope you had a very fruitful session learning about relaxation with me. I shall see you again with another video soon. I hope you take care till then.